Here to discuss, former Bernie Sanders national staffer Teslin Figueroa, author of The Working Class Republican, Ronald Reagan and the Return of Blue-Collar Conservatism, and senior fellow at the Ethics and Public Policy Center, Henry Olsen, and Fox News contributor and national security analyst Morgan Ortagus. Morgan, yes. First time on the show. It's very exciting.
Thank you. I'm happy to be here.
All right. So
I don't have the long title that Henry has.
Very,
but
exactly.
I like it. It's impressive.
Very short and sweet. So I want to go straight to healthcare.
Sure.
I think that there's a sort of sense that among the Republicans that, well, we tried to do it, didn't work, let's move on, let's do something else. I think that's really fatal. I think they've got to have an answer.
Yeah, your opening monologue was spot on, and that's what the polling indicates as well. Going into 2018, that's what voters were most concerned about, and I think it was actually surprising to a lot of us who were we thought it would be the president's tweets or the tone or this and that. It wasn't. People didn't care about that. Exactly what you said. People cared about knowing that they were going to be taken care of, and it is unconscionable that the Congress, the Republican-led Congress, I'll beat up on them. We don't even have to go to the Democrats. Had what, 8 to 10 years to do something. And here's what's even worse: the healthcare vote failed. We still haven't attempted anything new. Again, the Republicans have not. So if you go into 2020 without some sort of message, you can't just roll your eyes at AOC and say, "Oh, well, she's a socialist," and dismiss her. That's not a message. That's not fixing things. And so hopefully we're getting to a message at some point.
Very well put. I totally agree.
Look, I'm a Ronald Reagan biographer. And what Donald Trump needs to tell the Republicans that when Ronald Reagan endorsed Barry Goldwater on national television in 1964, he endorsed national universal coverage. He said that we conservatives are for telling every American, telling senior citizens that no one should be denied health care because of a lack of funds. Quoting Ronald Reagan. Ronald Reagan endorsing Barry Goldwater in 1964 made that promise. And Donald Trump should throw Ronald Reagan in the conservative Republicans' face, and he should say, I'm for it, Reagan was for it, you should be for it, let's make it happen.
That's really, I'm just thrilled that that's why we need Henry here to tell us that history. That's really, really interesting. I didn't know that. That is fascinating.
Yeah, and he had said it for years before, and that's what I unearthed in my research for my book, is this is a commitment to the idea that everyone should be able to have health care, even if it's funded by the government, but it shouldn't be government-run, it should be private sector provided.
That's why I said, so when I use that phrase, I use it in my book, universal free market health care, and I said, well, that's a contradiction in terms. No, the universal means everyone's covered, but it's delivered through the market.
Ronald Reagan was there in 1961.
And, and now that's the difference, Teslin, but the Medicare for All, that's popped up this week as an argument amongst the Democratic presidential contenders. Well, what does that really mean? Does it really mean the government running the whole thing and closing down private insurance? And, there's a sort of argument going on about that. But I was interested that Bernie Sanders, who really got this whole thing going, and you were part of that, and really he's the one that made this the kind of message that all Democrats are getting behind. He shifted towards that. I noticed today he was in a piece today saying, of course, it means no private health insurance. I think he said something like, look, the only private stuff that you have, you want to get your nose fixed, plastic surgery, that'll be private. Everything else, that's the government. That's what he thinks Medicare for All means.
I think he understands what Medicare for All means, but I don't think most people do. When you talk about who's going to actually pay for it, I think people hear universal health care. They hear that everyone wants to be covered, because even though I believe that health insurance is important for all, there's still some issues with Medicare for All that still needs to be explained, even though I worked on his campaign.
Yes.
I believe it just coming from the people's standpoint. The other day I went through some paperwork with my mom, who, she passed in 2016 while I was on the campaign. Her 7-day bill was $56,000 to be in the hospital, and she actually worked for the state of Oklahoma in the faith-based initiative program. My father passed away with 0 health care insurance. So there's a big, gap between those who don't have it at all, versus those who've never asked anything from the government that still can't afford to stay in the hospital state. So I think it is the emotion behind what Bernie Sanders is talking about, Medicare for all, universal health care for all. But Democrats have yet to define a message, much like the Republicans, on how is it really going to be paid for and what does it really mean.
Yeah, but I mean, it's very dangerous for the Republicans to step outside of that and say, well, and give the impression, which is what they have been doing, which is like, well, we don't really care.
No, you're absolutely right. It's not just a cost issue. It's that I think that the Republicans in the Congress don't really have a plan that they can get behind. Yeah. The last plan that we saw was the Cassidy-Graham bill,
yes.
which would pull the funds.
Oh, that was quite good, though, wasn't it? Because it's decentralizing.
And I think that perhaps that bill could be revived again.
Yeah.
I think that there might be a Republican appetite there again for that. But, you know, Republicans are missing an opportunity here to point out if you're unhappy with the current healthcare system, that is the system that President Obama and the Democrats put in place. And if you're running as a 2020 contender, Medicare for All, you're running against a plan that a Democrat president put in place. So a smart Republican could sort of make this argument and say this is why the current Democrat plan doesn't work. But instead, the Republicans have inherited a faulty plan that they criticized, but without a viable replacement.
Yeah, and you see, I'm just thinking, you know, where we started with President Trump and the State of the Union and his 2020 message. You know, in the end, I mean, it is Congress that has got to sort of make the law. But if he puts his weight behind that kind of now we know Reaganite Republican version of universal health care, I think that's really powerful. You know,
he's just going to have to drag this Congress kicking and screaming, I think. I mean, it's amazing to me the lack of innovative ideas.
Yes.
I mean, I really think the only one that we've seen come before is the Graham-Cassidy bill. So hopefully they'll revive that.
But Steve, it's also important we talk about businesses as well. You know, even though I know we need health care, I also had to shut my business down because I couldn't afford to put temporary employees on health care insurance. So there's a gap with that as well. How do
that's
small,
another great
medium
example
businesses
of
provide
these
health
real
care?
nitty-gritty problems that people want answers to.